wanted to start with thanking all of you for joining us. We recognize that this day will forever be a significant day in our country's history and in our future. So on behalf of Children and Family Futures and the Office for Juvenile Justice and Delinquency Prevention, thank you for joining us today for the Learning Academy webinar, Raising the Bar in Family Drug Courts, a look at the Family Drug Court Guidelines. For many of you, this is your first Learning Academy webinar. We just want to make sure that all of you are aware that all of our webinars are recorded and posted on our website to allow for a convenient training opportunity. Currently, we have 27 webinar presentations posted within our 5 Learning Academies, and after today, we should have approximately 2,000 total attendees across 45 states. Launched in 2010, the Family Drug Court Learning Academy consists of 5 learning stages or learning communities. Here you can see the first 4 learning communities that are geared towards different levels of implementation, starting with the planning community and moving all the way to advanced practice. No matter what level of knowledge you have about family drug courts and what stage of implementation your family drug court is in, you will be able to find a webinar to match your needs. In 2013, the Learning Academy launched its 5th series, the Knowledge Sharing Community. This series is comprised of 6 webinar presentations and focuses on capturing, sharing, and using knowledge to advance the practice and policies of family drug courts. Each webinar presentation shares knowledge drawn upon the experiences of acting and practicing family drug courts. During each webinar, current technical assistance products are featured as a way to share with family drug court teams and a growing body of knowledge and research regarding effective practices. After this webinar, make sure you take a look at all the past webinars to continue and to enhance your knowledge of family drug courts. It is our goal to make our webinars as interactive as possible. In addition to hearing from our speaker today, you will also have a couple polling questions, and we welcome your responses to them. We will share all responses with all the attendees, and this will help assist with the discussion. Throughout the presentation, you will have the opportunity to submit live questions for our presenters, and I will explain how to do that more on the next slide. After the webinar, you will receive an evaluation, so please make sure you fill this out completely. We take your feedback seriously, and we will incorporate them into improving our future webinars. And also, after the webinar, please make sure to visit and continue the discussion on our Family Drug Court blog. At the end of the presentation today, we'll provide you the web address to access the blog. So first, I'd like to acknowledge that we did receive many questions from all of you during the registration process. We tried to incorporate these questions into our presentation today. During the webinar, if you would like to ask questions, please use the dashboard on the right of your screen. You can type your question in there and send it to us directly. We hope to have some time at the end of the webinar today to address all the questions. However, if we are not able to get to your question, we will try our best to have them answered by our presenter after the webinar and post them on our blog. So let's go ahead and try our first polling question. We would like to know if you have downloaded and reviewed that Family Drug Court Guidelines publication. In a moment, the polling question, you can go ahead and select the response that best fits. So either I have downloaded it but have yet to review it, I have reviewed it but have yet to discuss it with the Family Drug Court. I have reviewed it and discussed it with the Family Drug Court team. No, you have not downloaded the publication but plan to do so. And no, I do not intend to do this at this time. Great. So it looks like the majority of you have not yet downloaded the publication but plan to do so. So on the next slide, we will show you how to go ahead and download the publication. So we definitely encourage you to do so. If you haven't done so yet, after this webinar, you can go ahead and access it during the webinar presentation. Now I would like to introduce you to our key speaker, the Director of the Family Drug Court Training and Technical Assistance Program, Phil Breitenbuscher.
Thank you very much, Alexis. I also would like to acknowledge my staff here, Russ Bermejo in particular, for putting together today's presentation, Jonathan Myers, others for assisting us today, and all of our staff here. So again, thank you all for joining us for this last webinar of the 2013 webinar series. I really believe that this one kind of culminates all of the Learning Academy thus far together kind of into one overview webinar. So I want to start first with going there and then a little bit, going backwards in time so that we can be here and now. The Family Drug Court Guidelines document really culminates about 15 years of work, and starting with the first Family Drug Courts convened in Reno, Nevada and Pensacola, Florida back in the mid-90s. And then you'll see here in just a moment how family drug courts began to spawn across the country, in large part because of the new deadlines and mandates of the Adoptions and Safe Families Act of 1997. What you see on this slide now is how quickly some of the family drug courts grew, and many of these family drug courts, as many of you already know, grew before the research and before there was evidence, before there was a lot of technical assistance. There were a lot of pioneers out there and innovators who were thinking, how do we take this adult drug court model, this thing that's working in the adult criminal justice system, and how do we apply it to our rising caseloads, where case after case we began to see was coming into the child welfare system due to substance abuse. And the imminent threat of losing one's children just wasn't enough to help these families get into treatment. There needed to be some other type of mechanism. There needed to be some type of immediacy and holding that parent accountable, checking in with them, a new way to engage families, a new way to hold systems accountable. And drug court model based out of Miami-Dade seemed like a way to do that. And so many of us in the early 2000s began to struggle with this concept, and we had very little research and literature to help us do that. Quickly they began to develop. We began to put together these family drug court models. We were learning from each other, and some literature was developed, and now we know in 2013 there's over 350 family drug courts. And to some degree, the research and literature has caught up, and I'm going to talk a little bit about that today. I also wanted to kind of pause and note another interesting kind of phenomenon that we see during almost the same exact period, in that when we look at this child welfare data and what we're seeing with reasons for removal, we see a continued increase. Now, we believe here at Children and Family Futures, this is clearly an underrepresentation of the cases. And I think when I go out and meet with you, and now I've gotten to work with over 200 family drug courts across the country, we know that when I ask this question to you in person of how many of your cases are affected by substance abuse in the child welfare system or in your court systems, many of you will say somewhere between 40 to 60, 80, sometimes even here 100% of the cases. But I do want to recognize the importance of this slide and of this data, that since that time of family drug courts kind of also taking off, there's been a greater awareness about understanding that children are removed due to alcohol and other drugs. And that's what this slide shows, that we go, again, about the time the family drug court started, we show in this data about 13 or 14% of the reason, up to double that now, up to 30%. And again, there's lots of reasons why this data is so low, lots of reasons because, number one, we think that it isn't always identified, unfortunately, right at the time of removal. Sometimes the understanding of the parent's substance use disorder doesn't really come to fruition, or we don't really know about it until well after the child's been removed. That's one reason. Other reasons are just as simple as that the data systems, the state-administered child welfare information systems, or SACWIS as we call them, don't allow us to easily track this data. But in any case, even though we think this is a huge undercount, we see that at the same time we're seeing family drug courts grow across the country. We're seeing the awareness and the ability to track that information also grow. And that kind of sets the stage for what I want to talk about and how the guidelines are kind of put together, in that we're looking at this in not just a court program per se. It is clearly a court program, and that's why we call it a family drug court. But it affects a larger system, and it requires systems to change. And the family drug courts really speak to that change. And I'm going to continue to underscore that point throughout today's presentation, especially when we talk about the differentiation between the 10 key components and the adult drug court standards and the family drug court guidelines. But again, going backwards, and where we're at really even today, I mean, when we first started family drug courts, we looked at three major systems. We have the court system, the drug treatment system, the child welfare system, all with multiple mandates, timelines, and training, the backgrounds of the individuals as well as agency culture, the values of individuals as well as agency values, the timing in which we have to respond to these parents. We often talk about the clock for the ASFA, for the Adoption Safe Family Act, which requires parents to make significant efforts in reunifying with their children within 6 or 12 months, depending on the child's age. And if they don't make those and aren't making those efforts, then the court has to terminate services and ultimately sever parental rights permanently. That timing compared with the timing of a parent's recovery, which is a lifelong recovery, is a lifeline clock, if you will. There's the clock on a child's development. So how do we combine these clocks or work cohesively, knowing that there's different timing on us and the different methods in which we even assess parents? We screen parents differently. We engage with parents differently. So we know that we started at least with these three systems, and still today, you have to have these three systems engaged and bought into the program, or you won't have a family drug court. And we know that many courts work beyond these three systems now. I also wanted to acknowledge that this document, the Family Drug Court Guidelines document, really builds and stands on the shoulders of some really pioneering documents. Of course, the 10 key components, but also the National Center on Substance Use and Child Welfare published a framework and policy tools for improving linkages between alcohol and drug services, child welfare services, and dependency courts. And that's the 10-element framework that was published over a decade ago now. The 10-element framework really looked at system linkages. And then in 2004, the Office of Juvenile Justice and Delinquency Prevention published family dependency treatment courts addressing child abuse and neglect cases using the drug court model. We also see the Family Drug Court Essential Elements as part of that document, and the National Drug Court Institute then later developed the Family Dependency Treatment Court Planning Initiative. And there's been other documents that are cited in the Family Drug Court Guidelines document and publication. And I wanted to make sure we acknowledge and say this isn't a document that goes off on its own. It really does build on some of these kind of key documents. But there was clearly a need. We conducted a needs assessment for family drug court training and technical assistance back in 2010. And time again, we kept hearing that although there was a substantial amount of new literature and a growing body of literature that began to put the pieces together for family drug courts, there was still this feeling that there was needed, and at that time, what we were hearing was a need for family drug court standards. To help measure and to set the table, if you will, set the bar for what is a family drug court, and how do you measure its effectiveness, how do you measure its fidelity, how do you score it and assess it to assure that it's serving parents appropriately. And we started kind of with that mission that we needed to look at, that we needed to develop family drug court standards through collaborative efforts and in partnership with federal and state stakeholders and subject matter experts, and really in looking at the research available, it came to be very clear that we weren't at a place yet in family drug courts to have our own set of standards. I'm going to come back and talk about the adult drug court standards in just a moment, but at the beginning of this project, which now is over 2 years ago that we started this, it was pretty clear that there just wasn't enough evaluation or research and literature to develop family drug court standards. So we backed away from that terminology purposefully and developed guidelines. And then what we really realized is that there's so much differentiation and variation between state to state and community to community that we really needed to develop a document that helped communities and states develop their own set of guidelines or standards, and in some states even a credentialing program, and a way for state drug court coordinators or court improvement program managers to go out and assess courts on where they're at in their developmental stage. And then it also serves a dual purpose for new courts or even existing courts to do self-assessment and to help them develop their own courts. And so in many ways, this document serves many purposes and speaks to multiple audiences. And I'm going to try to talk through some of that and try to speak to each of you looking at where you're coming from so that you know how to best use this document to support the work that you're doing. So again, going backwards, family drug courts created in 1995. We know there's over 300 in operation today. There's been a significant amount of training and technical assistance over the past 18 years, and a lot of those opportunities, as I said earlier, we've now got a chance to work with over 200 courts, and each court we go into, no matter if they're a first-time developing court or they're a 10-year peer learning court, we learn something from you. That information is then brought back. It's entered into a data system here at Children and Family Futures. That data system is combed through, and information is developed, knowledge is developed, and some of that knowledge is put into this document. And you'll see a term that I use here in the document called practice-based evidence. In other words, when we spoke to subject matter experts and when we looked at good operating courts that had good outcomes, they may have not have been able to conduct research-based or an experimental design in their family drug court, but they're having good outcomes doing certain practices, and that practice-based evidence is also included in these family drug courts. As I said earlier, most states have not created guidelines or standards specifically for family drug courts, and although there are a few, there are 5 or 6 states that have specific family drug court guidelines or standards. We'll talk later if you're interested in getting and seeing those. We're happy to share those with you. But there was concern that there were basically some states were applying the adult drug court standards and even outcomes to family drug courts. This is very concerning to us because what we see is that oftentimes that sets up family drug courts to fail. It sets them up to be compared against a system that they're not apt to be compared to. It's really comparing apples and oranges. And just one small example of that is that in adult drug court, one of the major outcomes, as it should be, is graduation rate. And typically in a family drug court, we're just not going to see the graduation rates in family drug courts that we see in adult drug courts. And that, again, goes back to 2 things. Number one, the timing, that ASPA time clock. And that the Adoption Safe Family Act really sets forward very strict timelines for the child welfare system and the courts. And oftentimes it takes much longer for a parent to graduate a family drug court or any drug court than is offered or allowed by ASFA. So that's one reason. The other is just clearly and simply that the primary purpose and goal of child welfare and the dependency court system is on permanency of the child. And so that is the goal in reunification. And if the parent is doing well and they've reunified, and maybe they weren't able to graduate, but they certainly benefited from the program, that should be the standard that we want family drug courts to live up to. And sometimes those parents aren't able to stay in the program due to life. They've got new jobs, they have children now at their homes, and they have created a support system, and they're just not able to stay in the program long enough to graduate. Of course, we would love all parents to graduate from the programs. We think that they do best if they stick and go through the whole program. But the reality is family drug courts won't have the same type of graduation rates that adult drug courts will. So there are some needs to set different guidelines or standards for family drug courts that take that into account. And then there's also opportunity to address the needs and strengths of the entire family. And that requires some systems change with multiple systems. And that systems change, again, is what I want to underscore, that the family drug courts build on to the adult drug court standards and to the 10 key components. So just for a moment, I wanted to kind of give you the framework for the document. The document is set up in 10 recommendations. Each of those recommendations provides a description of that recommendation. And then within that recommendation, we provide you with the research findings that supports that recommendation. And then underneath that, we provide a list or a menu in some cases of effective strategies that are sometimes evidence-based practices, promising practice, or practice-based evidence that we see are effective in family drug courts in improving outcomes and moving family drug courts to scale. So, and again, this is what I just spoke about, that the research is supported in those 3 categories. And we have an appendix in the back of it that you'll find these. The first category is the strongest support. In other words, this is supported by evidence from research conducted in a family drug court. And what we mean by evidence means they used some type of experimental design to support that research, and that they were then published in a referee journal. So they used some type of comparison group. They had a quasi-experimental design or even an experimental design that was then put forward and published after being peer-reviewed. So that's category number 1. The second category, after we looked at that research, we said, well, there's other research from other fields that are applicable to family drug courts. There's the child welfare and alcohol and drug research. So in other words, there's research from the substance abuse treatment field and the child welfare field that that shows that what's effective in treatment for families involved in the child welfare system. We wanted to incorporate that, and we brought that in. And then also we met with Doug Marlowe and with the NADCP folks, and we sat down and we looked and we combed through the adult drug court research, and we said, which of that is applicable, and can we also bring into the family drug court guidelines and effective strategies in the research? And then once we did all of that, we said, well, there's still some gaps, and so then we used practice-based evidence, which is common in family drug courts, but there's little or no research supporting those particular standards, but we know they work from anecdotal evidence, from going out and visiting with you, and from seeing them. And then that was left in there by consensus. Again, this document was reviewed multiple times by large stakeholder groups, including state drug court coordinators and subject matter experts and the federal government. And so, so we came to consensus on those items, which leads me right into how this was developed. It was, again, developed by a diverse group of subject matter experts. We started with a group of about 10 of us that were experts in substance abuse treatment and child welfare and in the courts. We had retired judges on the panel and treatment experts and you know, big-time people that you would all recognize their names in the family drug court field. And we combed through research and we came upon these 10 and we settled on these 10 recommendations. And then we combed through both quantitative and qualitative data, looking at 13 source documents as well as 32 individual research articles. And through that, we developed a spreadsheet that had over like 1,000 different indicators and fields in it. And then we brought that, we combined that into a document, and then we had this document reviewed and vetted by a large group of stakeholders, and we met in person over 3 or 4 times with state drug court coordinators and others and opened it up to feedback from the field. And this is where we landed. So let's start with a question that this came from you all. When you registered, we asked you to provide us with some questions that you wanted answered. And one of the questions I thought was very helpful in starting and kind of launching this presentation, you asked, is there a reason why these are practice guidelines versus standards, as now used by the adult drug courts? How are these guidelines aligned with the 10 key components and the adult drug court standards? Where is their overlap, and where do they depart? So again, very excellent question. I do want to start there. Again, as I said earlier, these are in many parts practice guidelines or systems guidelines versus standards. And I want to make a point here, and I want to be careful about how I say this because I want to make sure that I'm saying this in the way that's most respectful. But the standards are, I believe, and I think we believe here in Children and Family Futures, the standards should be applied. And as far as the first 5 standards that have come out from NADCP and for adult drug courts, when we view those, we see that every one of those do apply, for the most part, to family drug courts. And that's how you operate the program of the drug court. In other words, that's what happens in the courtroom, that you have to have judicial leadership, you need to have drug testing. Those types of kind of standards, those key components, those operational elements of the program apply to family drug courts for the most part. Where the guidelines differ is that we take into account that when you try to apply those kind of standards in the dependency court setting, working with parents involved in the child welfare system, you need to begin to engage in systems change for that to be effective. And as I go through each of the recommendations, I'm really going to underscore what I mean by that. But that's really the approach that we took in developing the guidelines, is that this is just as much about developing a court program as it is, or maybe more so, about making systems change. I think it was Carolyn Cooper back in 2010 or maybe even earlier who said, family drug courts provide a laboratory for change. And as I talked earlier about, as you saw the growth of family drug courts across the country, it's interesting that we also see the growth in the awareness and the tracking of parents or children, removed due to alcohol and drug issues. The family drug courts, we believe in many cases, and we've heard this time and time again, although they may only be serving 5 or 10% of a population within a particular jurisdiction, they're making larger systems changes because staff are becoming more aware of substance abuse needs and changes. There are policy changes that occur around doing assessment and screening for AOD disorders. And so those types of system changes have to occur for a family drug court really to be effective. When we go out to a court that's struggling to fill slots, to meet capacity, to get their numbers up, it's almost always because they really haven't engaged in that systems change work. And I'm going to talk about some of that. So let's talk about practice guidelines versus key components. So again, these are guidelines and components provide specific recommendations or benchmarks. They provide parameters for developing an effective drug court programs in different and unique jurisdictions and their context. In lots of ways, what we're trying to do is provide you with almost a way or a mechanism, a process for developing your family drug court or your guidelines or standards that meet your unique needs and allow you to be flexible. And those effective strategies that are provided can be used as almost a menu for your particular jurisdiction. It's offered in a way when we're still developing, and this was officially published in May of 2013, we've already begun making notes for Volume 2, a revised version of the guidelines, because the research is growing that fast. So again, this is a developing and evolving field, and we'll need to update this document as the research develops. Again, this is a tool for states to develop their own standards, and it speaks to what the research says and doesn't say in some ways. And we try to be very clear about that some of these things are really about practice-based evidence. They're not vetted in the research yet. However, your best practice standards that, again, the drug court, adult drug court has put into place set the bar, that these are the things you must do in order to be effective. This provides state drug court coordinators and funders in some ways, even though you may not hear that from Doug Marlowe, it provides them with a fidelity tool to measure their outcomes against standards. If you're not doing some of these things, you will not have the type of outcomes that you might otherwise see. So again, here are some resources: 10 key components, adult drug court best practices, and the family drug court guidelines. Those are the links. And I wanted to kind of do a crosswalk, and I want to also credit MPC research out of Oregon with some of this. And in a moment, I'm going to share a slide, and I think we credit them. But just as a refresher, here are the 10 key components: integrating treatment services, using non-adversarial approach, early identification, immediate placement, access to a continuum of treatment services, direct drug testing, responses to behavioral, judicial interaction, monitoring and evaluation, continuing interdisciplinary education, and forging partnerships. Many of those, as you'll see in just a moment, almost directly cross over into the 10 family drug court recommendations, which we start with creating a shared mission, developing interagency partnerships, creating effective communication protocols, ensuring cross-system knowledge, developing a process for early identification, addressing the needs of parents, addressing the needs of children, garnering that community support, implementing funding and sustainability strategies, and evaluating shared outcomes and accountability. And what you see in the column to the right is where those key components are crosswalked or bridged. So creating a shared mission, you'll find also correlates to key component 1, key component 2, and key component number 6. Again, there's the reference to NPC research, and I thank them for that. And this crosswalk needs further development and further fleshing out, but we did want to acknowledge this work. All right, so what are the family drug court guidelines? They're a framework built on a foundation of shared mission and vision, supported by client services and agency collaboration achieved by shared outcomes. And here, let's look at it kind of visually. Again, we believe, and I talk about this all the time in person, if I were looking at you, if you were a group of folks in the room with me, and I said we have to start with a shared mission and vision, I guarantee many of you would be rolling your eyes back in the back of your head, or pushing yourselves away from your desk at this moment and saying, oh, geez, oh, wait. But this is true, and I'm going to talk about how important it is to start with a shared mission and vision and to be revisiting this. And then these are those agency collaboration recommendations or strategies that must be in place. I'll go through each one of these in just a moment. And then, of course, almost in parallel or in a separate column at the equal time of equal importance is client services. So you have to be collaborating across agencies in a non-adversarial way at the same time that you're providing these valuable services to clients. But you can't provide services to clients without agency collaboration. And there's no point to collaborate unless you're going to be providing services to mutually agreed upon shared clients. And then all of this culminates up to shared outcomes. But these outcomes are important and shared across agencies. That it's not just the child welfare outcomes that we're trying to achieve. It's not just the substance abuse treatment outcomes that we're trying to achieve, but it's substance abuse outcomes for child welfare clients, or it's child welfare outcomes for substance abuse treatment. All right, so I'm going to now take the next 30 minutes or so, and I'm going to talk through each of these 10 recommendations, and also I'm going to highlight a few of the effective strategies that are notated in the publication. There's no way we have time to go through each one of the effective strategies under each one of the recommendations, so I encourage you to go back and go through some of these, but I wanted to just point out a few of them to give you a taste of what's in the document. So when we say that you need to create a shared mission and vision, what we mean is first starting with again, your understanding your core values and your principles, or shared principles we often talk about. The reason why we say starting with values is because when you call yourself, for instance, a drug court, that may speak to a certain population. When you call yourself a family preservation court or a family recovery court or a family treatment drug court, or when you say that the mission of your program is to reunify children with their parents, those are all value-laden terms. And what happens is that if you stick in if you create a mission statement without it being shared and discussed, and the values, underlying values of the particular agency's personnel and agency culture, then what ends up happening is that you burn out or you turn away otherwise interested parties. For instance, if your goal is to just reunify parents with their children solely, then that may irk, if you will, the children's attorney or guardian ad litem. They may feel like this isn't a program that they need to participate in or isn't important for them, or they may have some concerns about that. If you say your goal is just permanency of children and don't talk about the need for recovery, then maybe you'll get less buy-in from treatment organizations. So how your mission is developed and the words that you use really do need to be a collaborative process that addresses some of those underlying values and principles. Your mission and vision should build on consensus around who you're planning to serve. Who's your target population? How does that fit in with the partnering agencies' other initiatives? So if child welfare has multiple substance abuse programs that they're funding, where does the family drug court fit in? Who are the parents that this program should be focusing in on? Obviously, again, the adult drug court research is telling the adult drug courts to serve high risk, high need. Well, that I hear often that we're plugging that into family drug court discussion, and we're plugging that into our literature. But what does that even mean in the child welfare system? And the risk to that is, in some communities, the family drug court program is the only game in town for substance abuse treatment for child welfare clients. And if that's the only game in town, and we begin to say that, well, we are only serving high risk, high need, are you now becoming an exclusionary court? Are you taking us now from 5 to 10% of the population in the child welfare system to 3% of the child welfare population? So we need to be really careful about who we're serving and the language that we use to be sure that it's effective for your individual communities and your individual states. Which ties right into, of course, your eligibility criteria and the type of model that you use. When we say model, what we mean by that is whether you're using a parallel model, some type of bifurcated model, or an integrated model, meaning one judge, one court, And then there's all types of permeations of both those courts, and it's a continuum. So understanding the way in which you're going to hear these cases and and separate dockets, for instance, if you're going to use the same judge to hear the recovery and the dependency matters, or if you're going to keep that as one judge. All those things need to be developed and discussed as a team. Certainly the judge leads those conversations, but the attorney groups also need to weigh in. The county council or the child welfare attorney has an opinion on that. The parents' attorneys have opinions on those things. So who you're serving and the model you're using need to be developed in a collaborative manner. And then you need to revisit your mission and vision often. And when you have new team members, you need to have a way to orientate and assimilate those folks to the process. And in fact, whenever you go to expand your program or bring in new partners, meaning, okay, now we're going to bring in children's services to our family drug court, you need to revisit the mission and the goals and the target population. All of this has to be revisited. And again, you have to have some really concrete discussions around your values, because that does change the minute you bring in a new partner. So there needs to be some way for you to revisit that mission and vision. And then, of course, also an effective strategy is a way to develop policy or procedures to cover operational policies. So we have this shared vision, shared mission, we know who we're serving, we have to memorialize those or institutionalize those policies and procedures in the multiple agencies. And you do that in some ways through developing interagency partnerships so that you can coordinate the services to address substance abuse, mental health, and trauma issues in a comprehensive way. And then you're using that information and those assessments from multiple agencies to develop a coordinated, comprehensive case plan. And so, again, these interagency partnerships will help you to not duplicate services. Some of the very often services that are often duplicated are assessment processes, drug testing, and parenting. Parents go from one assessment to the next, and sometimes you see that you're getting mixed results. A co-located substance abuse specialist in the child welfare system conducts a ASI Light. They come up with a clinically or medically necessity for a certain level of treatment. And then they refer that parent on to a treatment center. The treatment center conducts another type of assessment, and based on that assessment, the parent may or may not disclose the same amount of information because the information from the substance abuse specialist or the child welfare department wasn't shared in an appropriate way. And so what happens is that you have a different level of need that's now determined, and then that causes strife between the organizations. We see drug testing often is done in multiple organizations, and we see parenting sometimes done. Parenting education programs are provided by multiple education. This creates obviously havoc for the parent and having to do these duplicative processes. It also then can provide you with mixed messages and mixed information when you're coming to the court hearing. Developing those interagency partnerships and coordinated case plans are important. And that's done through concrete things like linkages agreements, MOUs, and then having agreements on your family drug court advisory group, your steering committee, and your staffing or your treatment team. So who's going to be in each one of those groups? What does the structure look like to hear these cases, to ensure the program is operating effectively, and then also to ensure long-term sustainability of the program? Those require interagency partnerships. Not one agency can do or conduct a family drug court by itself. And then you have to have policies for sharing information with other providers and coordinating service that I already spoke about. Which leads us into, again, recommendation number 3. And as you're already hearing, I think, and seeing, is that none of these recommendations can be done in and of themselves, that they all overlap and interrelate. And so once you've kind of developed a shared mission that we say, okay, this is who we plan to serve, this is what we plan to do in a family drug court as a collaborative, we then need to develop those interagency partnerships and set up, okay, we'll agree to mutually do this through a memorandum of understanding. Now, how do we talk to each other? How do we develop a data management system that tracks and monitors the parents and the children in both case level and system level data? we need to be able to do case staffings weekly or biweekly, and so that means that we need up-to-date information about how these clients are doing in their treatment programs, with their visitation, with their drug testing. We also need to be able to track this data at the systems level. So are we able to track time to reunification, permanency, reentries, and can we compare our data in our drug court with the larger systems data? How are parents doing in our family drug court as compared to families in the child welfare system that aren't in the family drug court? Are we able to easily compare those types of data and parents? And the same thing with our alcohol and drug programs. So your data management systems and protocols for sharing that information, again, your confidentiality regulations to make sure that you can share that information at a case level and aggregate data level. So all these protocols need to be obviously developed, and your data systems need to be developed. And there's many other strategies listed out in the guidelines document. So you've said here's who we're going to serve, here's how we're going to do it in our interagency partnerships, here's how we're going to share data. What are we going to, how do we know that we're doing the right thing? How do we know that we're providing the best treatment? How do we know that treatment agencies understand the parameters and the mandates on the child welfare system? How do we know what the parent attorney's role is to zealously advocate for their client? What does that mean? How are we up to date on current literature with regard to trauma-informed care? You do that by ensuring cross-systems knowledge. And there needs to be a way that this is ongoing joint training programs that sometimes take the place of monthly brown bags where we're cross-sharing information about our own organizations, our own field, to attending formal trainings and conferences or even webinars like this, and doing joint trainings together where you are able to go and hear information as a team and then talk about what that meant to you as an individual or as coming from a particular point of view. So those are kind of the systems things, and this one is in many ways also a systems collaboration issue, and that you have to find a way to develop early identification and assessment process. So there's the training, and this one overlaps clearly with services to children and services to parents. But this, from a systems point of view, there has to be a way to develop or to identify these parents early on in the case, as early as possible. The closer we can get to identifying these, or the earliest we can get to identifying parents with substance abuse issues or substance use disorders, the better chance that we're going to have to treat that disorder and to either keep those children at home safely with that parent or to reunify with that parent, given our timelines. And so some of those really effective strategies are looking at placing substance abuse specialists or AOD providers in the child welfare offices or at the courtrooms, or how do you share or use those assessment results to create coordinated case plans. So the child welfare social workers or investigation workers are now collecting more information, I think, than they ever have, and they have access to a wealth of research from prior criminal history, prior contacts with CPS, what their living environments look like, all kinds of relevant information that when shared with the Alcohol and Drug Treatment Agency, with the Substance Abuse Treatment Agency and the evaluator or assessor at that office, can help get these parents in the right mode of treatment and sometimes help screen them in or assess them into the level of care that they really need. Getting those early identification assessment process set up so that you can get timely access to treatment. If parents aren't able to get to treatment within, in the standards it says 50 days, we see in family drug courts oftentimes that's much shorter, and some of our best courts are more like 20 days, 20 to 27 days. If we can get those parents into treatment at the earliest point possible, we're going to have the best opportunity to treat that parent and to reunify those children. And then developing that legal and clinical criteria for enrollment into your family drug court. There's multiple other strategies listed in the document. These are just a few. All right, let's take a break real quick and let me hear from you. I'm interested, and we're going to open up a poll here in just a moment. I'm interested in hearing from you which of these 5 family drug court recommendations would you most like to receive technical assistance in implementing in your family drug court. You can select up to 3 of these. Would you like help in creating a shared mission and vision, developing interagency partnerships, creating an effective communication protocol, ensuring cross-systems knowledge, or developing an early identification and assessment process? We'll give you just a moment. It looks like the majority of you, effective communication protocols, as well as about half of you are thinking interagency partnerships, cross-system knowledge, and early identification. So, as I said earlier on, and I acknowledge that the least fun one, or sometimes feels like the least needed, is around shared mission and vision. Again, we think that that is an important place to start, and that's why we built the foundation around mission and vision. But if you are interested in technical assistance in any of those areas, as you indicated there on that poll, please let us know. Send us an email. We'd be happy to assist you with that. All right, let's move on to the second 5 of these 10 recommendations. The first of which, and again, if looking at where you're at in the developmental stage of your family drug court, this is a must, obviously, is addressing the needs of parents. There must be a way for parents to have better access to treatment, for you to engage those parents early on in early engagement strategies and encourage early entry. These parents, by just providing them with referral and saying, come back here in 2 weeks or a month, oftentimes will not show up. And if you say, hey, we have this great program, it's called Family Drug Court, and we're going to provide you with all the support, and here's a pamphlet. We hope to see you on Tuesday. We often do a presentation where we say, if you build it, they won't come. You have to go out there and you have to engage those parents in a very strategic way, utilizing recovery coaches or recovery specialists, something like that, to engage these parents. You have to be able to deliver responses to behavior timely, so that your response is proximal to the behavior, and using behavior management, contingency management with these clients in a therapeutic way. You have to be able to utilize drug testing effectively. You have to be able to use a phase system with benchmarks for accomplishment to define the progress in their court, so the parents know that they're progressing through the system and getting closer to graduation and meeting the needs or meeting the criteria necessary to hopefully be able to visit more with their children or to reunify with their children and to move to close their case and to graduate. So these are all the things that obviously are kind of your key necessities in drug court. And again, so if you look at the guidelines document, you'll see that this has probably the most effective strategies listed for you to take a look at. And then we need to address the needs of children. This is a family drug court, and these children also, I think we all recognize, are coming from homes where they may have been prenatally or environmentally exposed to substance abuse. That takes a toll on these children's developmental ability and their social, emotional, and physical development as well. And so we need to at least, if you're at a place where, look, we aren't in a place where we can necessarily buy services for children, and we don't necessarily recommend that per se. What we're saying is that at least be asking and ensuring that these children that are of the parents in your core program, and your program has the opportunity to shine a light on these cases. In these cases, I mean these families. And within these families, I mean these children. These children, did they get the required screening? If they're 0 to 3, then they should have been given at least screened for developmental delays and given a captor referral. So are there access to interventions in your community across developmental stages? Do you have access to health assessments, neurodevelopmental screenings, assessments that address those physical, social, emotional, behavior, and psychological needs? And can you develop linkages to high-quality developmental programs like school readiness and educational support? And is there access to this continuum of services? And if there isn't, can you identify where the gaps are and can begin to address those? So I think we always encourage courts to start with asking at least the question, was the child referred? Did the child show up to that assessment? What were the results of those assessments? Starting there, every court should be doing. And then if you can build those better linkages as you develop as a court, you'll be more successful. If you're able to treat this child and ensure that their needs are met, some of these children really have atypical needs where they will have a lot of difficulty once reunified with that parent. And if that child hasn't been treated, that's going to provide triggers to that parent. The parent will have difficulty maintaining that reunification. So again, we strongly encourage addressing the needs of children. There are, again, multiple strategies listed in the document. And then clearly, in addition to, as I said earlier on, the three needed agencies, you have to have your court, your treatment, and your child welfare as your interagency partners along, which includes, of course, your attorney groups. But more and more, we need a greater community, a network of community support. So when we say the effective strategies, are you providing and conducting community outreach and education regarding your family drug court to the local community? Are you connecting with your faith-based community? Are you connecting with your service organizations and meaning, the animals, right? The elks, the Kiwanis, all of those kind of groups. Are you linking parents to continuing care services following their service? There's a brand new article, and we could probably post on our blog, showing the importance, underscoring the importance of providing ongoing support services to parents post-reunification. If your family drug court reunifies parents and graduates them at the same time and closes the case, you're going to be seeing reentries. Parents need to be reunified and provided with ongoing support for at least 90 days at post-reunification. And they need to be connected to a community of support. You need to be connecting to your family income support, your TANF programs, your housing programs, job readiness programs, all of those other community support organizations. And so as you grow as an organization, you begin developing or seeing these needs of the parents, you can begin connecting to these outside service organizations. And then clearly, for the program to be sustainable, you have to implement a funding and sustainability strategy. Some of these really effective strategies include, number one, having a budget that includes your family drug court infrastructure. So is the budget, talk about how we're going to fund a drug court coordinator, for instance, or the drug court case managers. That infrastructure is critical, because if there isn't a concrete budget that says this is how much we need for a coordinator, this is how much we need so that we can have team staffing, this is how much we need with regards to funding to ensure that we have the infrastructure in place, then people don't know what that, if it's not concretely written down in a budget, people don't know what that means, and people can easily cut those positions. Your budget should include services for adults. In other words, how much do we need to spend for treatment? How much does it cost for treatment services, for drug testing, transportation? What are the services for children? What are those other particular family services, such as parenting education programs, housing programs, for instance? What does it cost for our team to attend trainings annually, biannually, or quarterly? Is that included in your budget? And then how are you using, and are you funding an evaluation? Because if you're not funding the evaluation, you probably don't have one, which means that you're not able to show the results and the outcomes for all the good work that you're doing. And so at least costing this out so that you know what these costs are, and then you share this budget information with your partners, and you come up with joint funding strategies to maximize the support opportunities, so that not one agency's supporting this, and that the drug court is getting a grant and paying for each of these particular budget line items by themselves, but we're mixing or jointly funding these types of line items. And then you also are able to then know where your gaps in funding are. You're able to openly talk across agencies about potential gaps, shortages, or opportunities for that matter. And then you can go and do community outreach and education about your needs to a larger community and to large stakeholders and policymakers. So again, this item in particular has many strategies listed in the document, and we'd be happy to talk with you more about implementing some of those strategies. And of course, all of this work culminates into ability to evaluate shared outcomes to ensure accountability. And what we mean by ensuring accountability is accountability at the case level for parents and also accountability for the systems that we are serving these parents to our best ability and showing good outcomes for that work. So, but first we must start with shared outcomes. In other words, outcomes that you jointly agree upon. And when I say you, I mean the agencies that you're partnering with. And if you bring a new partner on board, making sure that that partner's outcomes are incorporated into yours. If you are hoping to have another stakeholder brought in, or you're targeting a potential funder, knowing what outcomes they're looking for so that you can begin to evaluate those outcomes and to track those outcomes and hopefully show those outcomes. And that outcome data should be shared within your team to improve your policies, procedures, and operations. And having that evaluator at your steering committee meetings on a regular basis, monthly or quarterly, sharing what they're seeing in the data is extremely helpful with programs being successful. Agreement on how you're going to share these evaluation results with your policymakers, the community, is very important so that not one agency or one individual alone is doing the marketing and stakeholder buy-in type of outreach meetings, but you're doing that as a collaborative. And at the very high level, again, many of these strategies listed in the document go from good, better to best. One of, strongly encourages that is the ability to identify comparison groups to make your evaluation results credible. Because too often we hear, yes, we reunify parents quickly. Compared to what? We have good access to treatment. We have better treatment results. We have better treatment completion. Compared to what is important to answer that question. And sometimes, especially in courts where you really and truly are serving the high risk, high need, hard to serve clients, if you're able to identify a comparison group that also has those similar needs and show what it looks like when those parents don't enter your drug court, you will show better outcomes in comparison to those similar groups. And when you show those outcomes will be the most cost effective as well. But oftentimes, comparing yourself to just a larger system, you may see that your program doesn't reunify parents as quickly as the system as usual. And so you need to really identify a comparison group so you're comparing apples to apples. So again, many more strategies listed in the publication. Just to recap real quickly, we really built this document on the foundation of a shared mission and vision, building in agency collaboration strategies and recommendations in parallel to client services and leading up to our shared outcomes. So let's hear from you again. Of these last 5 recommendations, would you most like to receive technical assistance in implementing? Which would you like to? Would it be addressing the needs of parents, addressing the needs of children, garnering community support, implementing funding and sustainability strategies, or evaluating shared outcomes to ensure accountability? We'll go ahead and open up the poll. All right, let's go ahead and close up the poll. We appreciate you responding, and we recognize now, since you can respond to multiple, it may take a few moments longer than previous webinars. Addressing the needs of children stands out with this one, along with implementing funding strategies and ensuring shared outcomes. So absolutely understanding that there's a great need for training and technical assistance around implementing funding strategies, effective sustainability strategies. And we are preparing some work on that, and that we will definitely do what we're calling Sustainability 2.0 here at Children and Family Futures, because there's a greater need to really understand how the Affordable Care Act will impact some of our programs and how some of those sustainability strategies can be brought in. There's also the growing number of jurisdictions implementing the Title 40 waiver programs and how those can be utilized more effectively for family drug courts. So we're happy to talk with you about effectively implementing effective funding strategies. Please, again, contact us, and of course, around those other issues as well. So I want to now move to question and answer and discussion period. And there were a couple questions that I thought were really helpful and insightful that I'd start with, and then we'll take some of your questions. And again, thanks for submitting those along the way in today's presentation. We meaning Russ and Alexis, have been tracking your questions all along, and so we're going to try to go through a few of these. But let's start with this one that was submitted during the registration process. And this question asked, are there self-analysis tools to see how our family drug court is doing? And is there technical assistance available for family drug courts interested in implementing the guidelines? I would say yes to both of those. First of all, I'll start with the second question. Yes, we're very happy to assist you in implementing the family drug court guidelines, whether you are a state or an individual community. And I'm going to talk more about that a little bit later on in the presentation under resources and next steps. And part of how we might provide that is that we offer to you a web-based self-assessment. It's one of the strategies to allow you to analyze how you're doing with regard to the family drug court guidelines. And so we would send out a survey link to you and allow your team members to rate yourselves, and then we would facilitate some training and discussion and action planning around those results. In addition to this, the guidelines assessment that we provide on our website and on our blog, and also we can provide you the link of this. It is listed on our website if you go to the Family Drug Court TTA page. There is the Baldwin tool, which looks at fidelity in comparison to the essential elements of family drug courts that you might be interested in utilizing yourselves. We also know that contracting with an effective evaluator also is very helpful in doing that analysis of your family drug court. And as I referenced earlier, NPC did a great evaluation of a court, and we provided that reference earlier in the presentation. So there's multiple ways to assess yourself with specific regard to the FDC. Yeah, please contact us and we can share with you some self-analysis tools. Someone else asked during the registration process, can we obtain other state guidelines for family drug courts? And the answer to that is yes. You know, some of those were simply applying a drug court or 10 key components, and others were much more kind of strategic about the type of strategies or standards that they implement in their states. Sometimes states needed to just have something in place because of a regulatory requirement or legislative requirement, and so you know, some might be more helpful for you than others. But again, we would be happy to share with you those that we know of. And if you are in a state where you have developed your own standards or guidelines and you would like to share those with the field, you can do that two ways. One, go ahead and just email those to us or email us a link to those on your website. Or two, you can also go onto the blog, our Family Drug Court blog, which I'll share the link with in just a moment, and you can post a comment there where we have a forum started for today's presentation. We'll be sharing links. And you can share your state family drug court guidelines or standards. We want to encourage that peer learning as much as possible. The next question, I think another really helpful and thoughtful question, are there more critical or higher priority guidelines? Any thought about developing incentives to adhere to the guidelines? I'll take the second one first. And if you haven't already, if you weren't able to attend the NADCP conference and hear Doug Marlowe's presentation on adult drug court standards, it's on YouTube, or you can go on the NADCP website and look and view that, because I think he does a really great job kind of distinguishing or setting the standards apart from, in this case, what I think this question is speaking to in some ways about incentives to adhere to the guidelines. And that at this point, these guidelines are not necessarily a setting the bar for receiving funding in any way. These are merely set out to provide assistance to states and communities in improving their family drug courts and monitoring the family drug courts. Whether or not you want to develop incentives at the state level or at the, obviously at the community level, the incentives in our view would be that you would have a better family drug court with better outcomes, and better outcomes then will lead to increased results and sustainability. But at the state level, there may be incentives around continuing funding, and we have been asked from state coordinators to begin to move these family drug court guidelines into checklist or a monitoring tool so that state drug court coordinators can go to individual communities and monitor their courts programs. So in that sense, that's up to individual states on how they want to use these. Are there more critical or higher priority guidelines? I think that they are very much interrelated. It's very difficult to run a family drug court without implementing all 10. However, if I were coming out, and as I have been out to several brand new kind of planning or early implementation family drug courts, what we say to start with are, starting again, as I said earlier, starting with that shared mission and vision as a team is number one. Starting then that identifies your target population, that identifies the goals of your programs, so you know what you're doing. Then you need to start with serving parents. So you have to really concretely talk about how you're going to identify these parents, how you're going to engage the parents, how you're going to get them into treatment, how you're going to monitor their progress. And then thirdly, if you had to start with just 3, I believe that the third one needs to be developing shared outcomes. So that you have agreed upon outcomes across agencies so that you know if you were effective at all, if you know that you've done a good job. And of course, you really can't do any of the, you still need to be able to do those 3 effectively means that you also probably will need to have interagency agreements. You'll have to have ability to share information across agencies. You'll have to have some type of funding, on and on. You see how they interrelate and overlap. But if you had to start with 3, those would be my recommendations. All right, let's go back to, let's go to a couple new questions that just came in. I just was handed this question. If we are reading if we are reaching the entire target population, how are we to get a comparison group? So I have really yet to see a court that is reaching the entire target population, unless maybe you are in a very rural court. And in which case, that's a very excellent question. And I think maybe one of our research evaluation staff would probably be happy to follow up with you more on this question. But here's my thoughts on that. One, again, I think that I haven't yet seen this. I've seen in some rural courts where they're reaching 30, 40, 50% of the population who is affected by substance abuse, and we think about 20 to 30% would be scale. That's about the biggest courts that we see are approximately 30% of the population. Now, so that's number one. I haven't necessarily seen that, but let's take the question at face value and say if you are reaching the entire target population, I guess the first question would be, does every single person in that group, when you say reaching, does that mean they're engaging in the court? Because one of the quasi-experimental design might be that they meet criteria, but they decided not to attend the group. They decided not to enter the court. You could track those parents that way. Another way to do it, if that doesn't seem reasonable to you as one methodology, another might be to look for a very similar jurisdiction in your particular state with similar populations and demographics and compare their system or those parents' outcomes to yours. So, and I guess the third would be to do a historical group. If you're able to identify parents through case review or some other type of mechanism that looked at, case characteristics, demographics, before you implement them in your family drug court and after, those are some other methodologies that we've seen. And if, again, it's a question that I think Russ will post on the blog, And those of you that are evaluators in the audience, if you want to add to those ideas, feel free to post some comments on that. We'd encourage that dialogue. Great question. Next question. What are ways to compare apples to apples between the Family Drug Court clients and parents in regular dependency hearings? I think in some ways I've just spoke about that. So again, it's about identifying those particular characteristics. So starting with being as clear as possible on your target population. Who are you really serving in your Family Drug Court? And being as, and if you're as, the funnel being as open as possible at the top end, meaning every parent with a substance use disorder, all the way to most restrictive, I guess you would say, or looking at, those parents with a substance use disorder that requires a certain level of care, such as intensive outpatient or residential care, or if you're looking at a certain age group of children. So whatever your criteria is for your Family Drug Court, that then becomes their criteria that you look at with your larger dependency matters. And so that's a matter of doing some case reviews. And it is complicated, and if that's something that you're interested in and receiving some technical assistance around, we'd be happy to help you. But it does require really partnering with the child welfare system and having access to that larger set of child welfare information data. And that can get tricky and somewhat difficult, but we've had some experiences in doing that and working with the Regional Partnership Grant Program and also the Children Affected by Methamphetamine Grant Program funded by SAMHSA, and where we are looking at the clients in the larger child welfare system that are using propensity matching and propensity scoring, are looking at similar case demographics, and so you're measuring apples to apples. So again, that's a good question and probably worthy of posting to our blog and having some further dialogue on. So again, there's probably more questions. We'll take some of those offline. I'm going to start moving towards next steps and resources and how you might implement the Family Drug Court guidelines. Some of these things I've talked about already. The recommendations really have a wide range of utilization from the state level and the local level. At state level, and also in planning a new court, all the way to advanced practice, from leaders or policymakers to service providers or direct line workers. I think that this document is useful on each of those continuums in a wide range. So, so how can we help you? What are some of the TA resources available for you? Within the document itself, one of the appendices is a facilitator's guide that walks you through how you develop the team to begin either developing a Family Drug Court or developing your state standards or guidelines, and who should be involved in that team. It provides with even sample agendas to kick off your meetings. It provides you with sample welcome letters or invitational letters. It provides with sample system walkthroughs or communication protocols. So that facilitator's guide is, I think, very helpful appendix, and that's in the back of that. And then once you've kind of developed, all right, we have the right folks at the meeting, we've come to consensus on that we want to develop standards, you can begin walking through the guidelines and looking at the effective strategies in almost a menu fashion, picking and choosing what you want. But we can be helpful with that also if you're interested in that. We can provide you with state drug court guidelines. Again, each one of these guidelines has been in some way highlighted or focused in the Family Drug Court Learning Academy webinars. And so over the next 10 days, what we're going to be doing is posting on our Facebook and on our blog. If you're not yet hooked up to our Facebook and have liked the Children and Family Futures Facebook, please do so, because each day for the next 10 days we're going to break apart these drug court guidelines, and then we'll link to it on our Facebook and our blog. We'll provide links to the webinars that relate and go more into depth than we were able to do today, sometimes we've spent 1 or 2 or even 3 webinars on each one of the guideline recommendations, and that so that means you have an hour and a half to 4 hours of content available in our Learning Academy on each one of these guidelines. And then we also have some collaborative tools, both through Children and Family Futures and through the National Center on Substance Abuse and Child Welfare that we'd be happy to share with you. So just again, the message here is contact us at FDC@cffutures.org, and we'd be happy to connect you with any of these resources. Some of these things, I think I touched on this a little bit with the question around which of these 10 recommendations do you get started with. Again, all recommendations are interrelated. Several themes apply across recommendations and considerations, which are around the resources available to your community. Resources are important to think through, and this is why it's so important to develop your shared mission and vision that identifies that articulates who your target population is, because that has a direct correlation with the resources available. If you're saying that you want to target, for instance, residential treatment, parents who need residential treatment, but you have very limited beds in your community, that may not be the best target population for your family drug court. If you're going to define your target population in terms of developmental needs for children, but you have very little access to treatment for children, then you're going to run into some problems. So again, those are some considerations when thinking across each of these recommendations and where to start and how they impact some of those areas. Again, if you like technical assistance, we'd be happy to help you use these recommendations as a guide to either enhance or implement your family drug court at your local level, or to even assess your court. And at the state level, you can compare it to existing guidelines or standards or develop your own. So here are some other ideas that you might take advantage of is using the Family Drug Court Guidelines self-assessment, connecting with our peer learning court programs and comparisons with where they rank on the guidelines assessment tool, requesting site visits and on-site training, or developing your own guidelines. Guidance at the state level, we can provide assessments across the family drug courts in your state. So we've provided that in several states now, where we provide links, individual links for each of your courts. They can individually assess their strengths with regards to the effective strategies within the 10 recommendations, and then we can that can provide you, I guess, with a roadmap for prioritizing your improvement efforts, or what types of training are needed for your state courts, or how to develop your statewide trainings. It can also be effective in kind of a pre-test, if you will, or some type of starting place when you're developing your statewide guidelines. So let us know if you're interested in some of that help. But if not, I think that you can utilize the guidelines on your own as well in doing some of these things. I've talked about this. Please contact us if you're interested in some of this. So I did already speak briefly about the peer learning courts. If you are interested in connecting to the peer learning courts, please contact us at peerlearningcourts@cffutures.org, and we can talk. We can connect you with them and how they are really working through many of these recommendations and implementing many of these effective strategies in their courts. I spoke a lot about this, so here it is. We're going to be highlighting the 10 Family Drug Court Guidelines or recommendations on our Family Drug Court blog, which is at www.familydrugcourts.blogspot.com. Each day we will break apart one of these recommendations, and we'll provide links to webinars and other resources so that you can get a fuller understanding, and we can kind of dissect each one of these recommendations. And we'll be doing that over the next 10 business days. We also encourage you just to join the new Family Drug Court Learning Academy blog forum. This is where you're able to add forums, to have peer-to-peer discussions, post questions that you're interested in, create new forums, We hope this is interactive and helpful for you, and we know we've been asked about this in the past, and so hopefully you'll take advantage of this new opportunity. All right. Well, I want to thank each and every one of you for taking the time today to participate on today's webinar. This will conclude the 2013 Learning Academy. I thank each and every one of you for the work that you're doing with children and families. I thank you for your interest in improving that work. We recognize this takes time out of your day to attend these types of trainings, and we appreciate that time. I also would like to again thank the Office of Juvenile Justice and Delinquency Prevention for providing the support to host and facilitate this Learning Academy webinar. And again, I'd like to thank the staff who put this all together here at Children and Family Futures. So again, thank you for joining us. Please take a moment to complete our evaluation, which you'll be referred to once you exit the webinar. Thanks again for your time, and thanks for all the work that you do on behalf of children and families.